Good morning. This is Let's Talk Dentistry. I'm Dr. Bill Sulkowski, and my guest today is Dr. Jack Sahlaney. Dr. Sahlaney is a specialist in orthodontics. I'm a general dentist. Dr. Sahlaney has an office in Upper St. Clair at South Hills Village, and I have an office as a general dentist in Canonsburg. We're going to talk about Invisalign. Invisalign is a removable orthodontic treatment in lieu of the wires and the brackets that are placed on teeth to straighten them out. I'm going to start off by just asking and making a statement. Does your mouth give away your age? When you think about aging, do you worry about your teeth and gums? After all, almost nothing gives away your age as much as old-looking teeth or receding gums. And it's not just about appearance. It's also an important indicator of your overall health. Taking a look into someone's mouth, I can tell how well they've been taking care of themselves and whether or not certain health issues might develop. How Invisalign or orthodontics in general helps on the overall health is by aligning teeth properly, they are more easily cleaned, more easily cared for, less chance of gum disease, less chance of food impactions, easier to brush your teeth, easier to floss your teeth. That addresses the health issues. As far as the overall appearance of teeth, that speaks for itself. We are blessed in America by having people like Dr. Sahlaney in orthodontics and general dentists who do orthodontics. And you see most people, especially in the younger generations, have perfectly or very pleasing smiles and alignment. And that is due to the advancement in orthodontics and the work and efforts of orthodontists and general dentists in that direction. So I'm going to ask Dr. Sahlaney, what is Invisalign?
Well, thank you, Bill. Invisalign, and if we could go to the PowerPoint presentation, I'd like to just go over some things. Invisalign is an aesthetic orthodontic treatment developed for adults and teens who can benefit from straight teeth. And what Invisalign is a series of clear, called tooth positioners or retainers. And they're removable, and that's a big advantage because you take them in and out, and they slowly move teeth. And the technique from Invisalign it's a computer-enhanced program, which is based out of California. And, they sit down with us, and we systematically work up the treatment plan to move the teeth. The big advantage of Invisalign is it's invisible. You don't have to worry about braces and wires. As you see from the screen, it's to be worn 24 hours a day. You do not eat, you do not drink with it. You can drink water with Invisalign. And the advantage of Invisalign is it's invisible. So I always tell the patients, if you're going out one night, going out with friends, don't wear it. I mean, unfortunately, you have to wear it to move teeth, but if you're going to be going out with friends, a chance to maybe lose the positioner, don't wear it. And that's a big advantage. It's to be worn, you get a set of upper and lower tooth positioners, or we call them the Invisalign retainers. You wear them full time for 2 weeks. After that, you put another set in. After about a 6 to 8 week interval, you go visit your dentist or orthodontist, and they'll give you another set of positioners. And like I said, the big advantages of Invisalign compared to conventional braces, there is less patient discomfort. Invisalign has been proven it's a lot more gentle on the teeth. Also, the ability to remove the Invisalign positioners improves oral hygiene. As you'll see here in a little bit, it cuts down on cavities and decay. It allows you to keep your teeth clean compared to conventional braces. Also, unfortunately, with conventional braces, we have some poking wires and It can cause some ulcers to the lips and gums, so we have less of that with Invisalign.
You know what I find, Dr. Sahlaney, is patients love the Invisalign because they're getting braces, they're getting their teeth straightened, and they do not have to show that they have wires or brackets on their teeth. A lot of older adults, or even, it's you see it in the office a lot where sometimes somebody doesn't want to look like they're 16 again, so to speak, or sometimes 16-year-olds don't want to have braces or the wires to make it look like they're 12 or something like that, because oftentimes braces are put on around 12, 13 years old. So it's a great alternative to those who want to brush their teeth normally without the wires and the brackets. They straighten their teeth without having to go through the bracket and wire utilization. They can take them off, go out, and it's like their teeth are getting straightened, but no one knows about it. And they're clear, so even when you're at work or at school, you can have them, you can talk with them, and you have to really look closely to see that even there's an appliance in your mouth. So they have the effect of straightening your teeth without many people knowing that they're getting straightened. There is a compliance factor, though. If you have to be mature enough to understand that you have to wear them, and those that wear them, it works. And that's the biggest thing is compliance, utilization, and it's been a great device in my office.
Right, and basically the things that you just went over, Bill, the advantages with Invisalign and general orthodontics braces, as you straighten the teeth, it's easier to keep the teeth clean as we get older. And that promotes healthier gums. And also with straight teeth, you become, you have a nicer smile and a more confident patient.
And it comes down to, as you said, does your mouth give away your age? And, we are all trying and wanting to have the longevity issues, and if you want to keep your teeth nice, they have to be easily cleaned and flossed. And if they're crooked and crowded and overlapping, that can't happen. We're going to take a break. We'll be back in a minute or so. That's actually the logo.
Surprised to know the biggest dangers your pet faces are everyday dangers, like drinking from puddles, being boarded, squirrels in the park, and fleas and ticks. Being a pet is risky business. That's why it's important for every pet to receive a risk assessment and wellness exam twice a year. A risk assessment from your veterinary professionals helps create a unique risk profile for your dog or cat. Your veterinarian can then develop a disease protection plan that's right for your pet and the disease threats in your area. Best of all, twice-a-year exams help your veterinarian detect, treat, or prevent health problems before they become serious. So reduce the risks. Contact your veterinarian today for your pet's wellness exam, because being a pet is risky business. A message from the American Veterinary Medical Association and your local veterinarians.
Tell me what's bothering you.
As a hot dog, I know I'm responsible for some bad things. Now they say my cholesterol is a risk factor for stroke.
And how does that make you feel?
Like a big weenie.
High cholesterol is an important risk factor for strokes. Eating right and exercising can help. But National Stroke Association wants you to know that even the healthiest people are at risk. So ask your doctor about medicines that can lower cholesterol, like statins. It's even more important if you've already had a stroke. Visit stroke.org today.
Maybe it's the music.
Yeah.
Welcome back. The program's Let's Talk Dentistry. I'm Dr. Bill Sulkowski, and my guest is Dr. Jack Sahlaney, an orthodontist. I'm a general dentist. The program today is invisible braces, code name Invisalign. It is a removable orthodontic appliance that straightens teeth instead of the conventional wires and brackets. Anybody who's had that can attest to the fact that they gather food. They're hard to keep clean. And the reason why you straighten teeth, not just for looks, it's for function, and it is for easily accessible to brushing and flossing so that you don't develop age-related diseases associated with gum disease, long teeth, lack of bone support, and tooth loss. And the healthiest people have the healthiest teeth, and that's exactly irrefutable medical and dental facts. Now, what are the difference between, Dr. Sahlaney, Invisalign? What are the advantages, I want to say, of Invisalign versus traditional braces? We've talked about keeping teeth clean. We've talked about longevity of teeth, but maybe you can further talk about that.
Thanks, Bill. If we could just go to the PowerPoint presentation again. Just want to show you a picture where an individual's had braces, and as you can look from the photograph, as you look right here at the photograph, there's a white spot or decalcification. Unfortunately, this is the major risk and limitation of conventional braces. Every procedure has risks and limitations. In orthodontics with conventional braces, the number one risk and limitation is decalcification, and which can lead to cavities. So that's the major advantage that Invisalign has. They're removable, so it allows you to keep your teeth clean and tries to prevent these white spot lesions, which is decalcification, which can lead to cavities. And what I tell people, patients, the benefits are obvious. You look at this individual case here. You have the lower anterior, the lower front teeth. They have some crowding. As we get older, it becomes more difficult to keep clean. And these areas can be areas of plaque buildup, and which can lead to, of course, cavities and gum problems.
To put that picture back up again, Doctor, because I wanted to, if you look at the lower teeth, the incisors, and you see the crowding and you see the angles of the teeth, and we see this every day. People who brush, right where those arrows are, people brush and don't change the direction of the toothbrush based on the long axis of the tooth. So what happens is, you have a tendency to just keep the brush lined up. You're pretending that the teeth are all lined up, but what happens is these areas in here, if you could point them out, Dr. Sahlaney.
Yeah. If you could go back to that, please, and then just...
You see plaque will, on somebody who's even brushing their teeth properly, plaque will form where this arrow is, and it'll form in these areas between the teeth. And the reason is people are brushing up and down, and here you can see where the arrow is that the teeth are straight, and it's when you're moving your brush up and down here, it's easy to keep them clean. But when the teeth are angled, you have to have a incredible manual dexterity and or the consciousness to move the angle of the brush on the long axis of the tooth, so that you because all of teeth cleaning is mechanical. I mean, the toothpaste and the mouthwashes do not clean the teeth. It is the mechanical of the vibrating toothbrush and or the toothbrush in general that the bristles clean the teeth. And if you're having improper angles of teeth, you cannot clean your teeth properly. And invariably, people who think they're taking good care of their teeth will come into the office. Generally, their whole mouth will be clean, but those teeth that have angles that are not conducive to brushing will have gum disease in those areas, and it will lead to further deterioration, cavities, and tooth loss. So that I recommend every day, for no other reason, that people get their bottom teeth, with those angles that bad, corrected, so that they can properly clean their teeth and avoid the tooth loss, the aging process, the decay. You know, braces are relatively inexpensive when you look at the amount of time that they're, you know, if you're 20 years old or 15 or 12 and you have straight teeth till you're whatever age, it's a small investment. And if it helps you to avoid gum disease, root canals, crowns, things that are restorative and reparative in nature, then it becomes even greater bargain. And when you factor in the health consequences of you know, gum disease in terms of bleeding gums and the bacteria getting into your bloodstream through those bleeding gums and the reaction to that bacteria that your body creates in your bloodstream and how it affects organs, the heart, the brain, the liver, kidneys, then you say, well, if I could avoid that by getting braces, why wouldn't I? You know, that's one of the other factors. It does affect your overall health, and I find that as a general dentist who emphasizes periodontics, that, you know, we have that connection.
And we, like you just reviewed there, Bill, it's beneficial as we get older, because unfortunately as we get older, as individuals, our manual dexterity decreases. We're also on medications which decrease salivary flow, so it becomes very difficult to keep your teeth clean. Also, Invisalign is very beneficial for spacing. And then go back to the PowerPoint presentation. You have, you know, the upper jaw here with some spacing, and the arrows point out the spacing. This can be areas of food traps, impactions, and it's very difficult to keep the teeth clean. So by closing the spaces, keeping the teeth nicely straight into line, it's very easy to keep them clean. And like you just reviewed, Bill, it preserves your dentition and your gum tissue.
Now, just to comment about this, the orthodontic part, based on the closing of the space, we see people every day that come in with food impaction. They eat something, there's a bad contact like that model showed before in these areas where the arrows are, and you'll eat celery, meat, chicken, something fibrous, and it'll get stuck in the gum, and they come in and it's swollen. And if it isn't stuck in the gum, if it's stuck in the gum for a long period of time, you can get abscesses and infections. So by closing those spaces, you are no longer have the, like this program shows, you don't have the spacing where you can jam food into the gum, and it no longer, it takes that off the table, and you preserve your gums. It's easier to keep clean. You don't have to carry around, some people have to carry around floss, you know, just to, every time they eat something. Spacing is a problem. Invisalign does take care of spacing. We're going to take another break and finish the third segment of Let's Talk Dentistry with Dr. Sulkowski and Dr. Sahlaney. Dr. Sahlaney is available for consultation at 412-833-3922. And I'm available for consultation at 724-745-0103. But Invisalign, you can talk to your general dentist, and he or she will be able to point you in the right direction for treatment. We'll take a break. Just go there, please.
Out, but your food safety plan is on. Don't open the fridge. Foods will be safe for up to 4 hours if the door stays closed. Keep the freezer shut too. If it's full, the food will stay frozen for about 2 days. When power returns, make sure freezer foods have ice crystals, and check fridge foods with a food thermometer to make sure they're at 40 degrees or below. If not, or if there's any doubt, throw it out. Learn more at www.askkaren.gov or call the U.S. Department of Agriculture's Meat and Poultry Hotline at 1-888-MP-HOTLINE.
Member now. My service gear. I look sharp. I want to help people. I want to make a difference. I want to get things done.
Join AmeriCorps.
What have you done for your marriage today?
I took the baby while she worked.
Today we've actually organized a date night tonight.
I got up with the baby while he slept.
Yeah.
What have I done for my marriage today?
That is a great question.
I've carried my wife's purse.
Boy, I gave a huge hug this morning, like a really big squeeze.
We're going to the museums as a family.
What have you done for your marriage today? Don't forget the small stuff. Need ideas? Go to foryourmarriage.org, a message from the Catholic Church.
This is the training manual for a 747, and these are the documents you'll sign at closing. Now, no one climbs into the cockpit without knowing this inside and out. Yet while making the biggest purchase of their lives, most people only pretend to read these. That's why the Mortgage Bankers Association made the Simple Facts, something you can read and understand long before closing to help you get the loan that makes sense for you. Get your copy at homeloanlearningcenter.com. The Simple Facts. The name says it all.
Oh, okay.
Nice,
Yeah,
yeah.
right. I understand what you're saying. Hi, we're back, and it's Let's Talk Dentistry is the program. I'm Dr. Bill Sulkowski. Dr. Jack Sahlaney is an orthodontist. I'm a general dentist. We have talked about Invisalign and how it straightens teeth without the wires, without the brackets. We've talked about the reason why we'd like, as dentists, to have the overall health of the patient improved by having teeth that are straight so they can take care of them better, so that it eliminates, it facilitates toothbrushing and flossing, so it takes the crowded and the crooked and food impactions away off the tables so that people can keep their teeth nice for their whole life. We probably didn't mention something about bad breath, because when you have food impaction, you have rotting and decaying food stuck around your teeth, which is kind of a gross, kind of like there was a guy who came in the office who was, he's a Peters Township guy who was into toxic waste and toxic, to mitigate toxic waste and to kind of OSHA kind of things, and he had issues with gums, and he wasn't quite convinced he needed it until I said, around your gums and around your teeth, it's a toxic waste dump. And he was in the office the next day getting the cleaning of his teeth below the gums. So the bottom line with this is, when you have Invisalign and or braces, although Invisalign is so much easier to use in terms of brushing your teeth and taking care of them, in a case like this, where if we can look at the video or at the screen here, this gentleman had food impaction caused by the spaces. And can we get this up?
Can
on
we go to the PowerPoint, please? And we'll just, there
you can see the left, it's the same person here, and he was getting food impaction, and it was affecting his mouth odor. And after Invisalign, Dr. Sahlaney.
And like you said, he was in this treatment for about a year and a half. It doesn't speed up the treatment compared to conventional braces. It's about the same amount of time. And like Dr. Bill said earlier in the presentation, the big thing about Invisalign is you have to wear the positioners. And to go back to the screen, and like I said, this young man had a series of about 25 to 30 tooth positioners. He wore them full time. He changed them every 2 weeks. He came to the office, and you go from the left side of the screen to the right side of the screen in about a year and a half. So it's about the same amount of time as conventional braces, but the big advantage is he did not have to deal with the wires, brackets, and the other problems. Unfortunately, sometimes the problems you do have with conventional braces. Another little case here, like I said, another little spacing case, not as severe. This was a little bit less in time, about 12 months. And like we said before, it is compliant. The success of this case depends on how compliant you are wearing the tooth positioners. If you don't wear them as much, the treatment time will be longer. And I think we reviewed this a little bit ago. It's a lower crowding case, and this is probably the borderline of crowding that Invisalign can do. It's not a magic bullet, but it's another alternative for straightening teeth.
The biggest issue here, when you look at the left of your screen here, the crowding, the way the teeth are aligned, there's such a broad contact between them, it's almost inevitable that you get cavities and gum disease there, because it's next to impossible to keep that clean. So for no other reason, I mean, you could say, well, you know, orthodontics is, you know, elective because it's cosmetic, but it is in most cases it is not elective, because the cosmetic issue gets taken care of, but it becomes the health issue that's corrected.
That's correct. As we get older, as you reviewed before, our manual dexterity decreases. As we get older, we're on more medications, and unfortunately the side effect of certain medications, it can cause dry mouth. And one advantage of salivary flow, or I like to say is our saliva in our mouth, is to keep our teeth clean. And as we get older, we decrease salivary flow. Here's another interesting case, Bill, where we go back to the screen again, the PowerPoint presentation. You have a little bit of edge to edge here in the front. I apologize for the quality of the picture, but you have edge to edge. The teeth aren't fitting properly. After about 18 months, we have a result like this. And again, it goes back to you have to wear the positioners.
But you can see also, look how the gums near the teeth are kind of red.
A little puffy, yes.
A little puffy, and that's because the teeth are so misaligned that the person's brushing their teeth, but they can't brush their teeth effectively because of the different angles. If you look at that top case, each tooth is angled differently, and that issue creates the problem with gum disease there. And you can see how now the bottom, if you were just to brush normally up and down, you're hitting all the teeth with the brush. You don't have to angle a toothbrush based on, you don't have to be a magician or an engineer to brush your teeth when they're straight.
And here's a case where probably about 6-7 years ago, Invisalign had trouble getting from the top picture to the bottom picture, but as like any procedure, they get better as the years go on. This is a real nice case. Deep bite cases were very difficult to correct, and after about 12 to 16 months on this case, you got a real nice result.
Now, when you say like deep bite, for instance, you can see how the overclosure of the top picture, what that does is create unnecessary trauma to the teeth, and wearing.
You do wear your teeth when you have a deep bite, and that's a very good point. It does preserve, as we say, preserve the biting forces of the teeth. You do not wear the teeth down. Last case here we'll show you is another spacing case where, you know, this individual, the teeth aren't overlapping properly. If untreated, it'll cause abnormal wear of the front teeth. So you go from the top to the bottom, a real nice case. It took about 16, 18 months. And this is that individual. And in closing, like we said before, the advantages of Invisalign, it's not a...
time. I think what we're going to do is, what's your website? Maybe people can go on your website.
Our website, we have pictures of cases. It's jjsmac@penn.com, penn.com. Or you can just call the office at 412-833-3922. We recommend, talk to your family dentist and or your orthodontist. They'll gladly go over the alternatives and the advantage to Invisalign.
Well, thank you, Dr. Sahlaney. The program has been Let's Talk Dentistry. Dr. Bill Sulkowski, Dr. Jack Sahlaney. Any questions, please call us. This is meant to be a public awareness program where questions, some of the topics we discuss are people who send in questions, so feel free to do that. And hopefully we've addressed some issues and helped some people the skill level and knowledge to better health, better longevity, and keeping their teeth. Remember, don't brush and floss all your teeth, just the teeth you want to keep.